So is hormone therapy safe? I think that a lot of the fears of hormone therapy stem from the trial called the Women's Health Initiative, which was a very large study that was done in the late 90s, early 2000s, and it was a great study, and we've gotten a lot of wonderful data from it. The problem was that the results were leaked out to the public before the study could actually be studied by the experts and the results validated. The problem was also that the results were grouping women of all different ages together. So there were women spanning from ages in their 50s up until their 70s. And when they looked at the results and they reported that women were at an increased risk for heart disease and breast cancer if they took hormone therapy, that was not true. It was only part of the story. And the reason is because there's something called the timing hypothesis. So the timing hypothesis means that if a woman starts hormone therapy within 10 years of her final menstrual period and she and her doctor decide that she is a good candidate, then yes, it is absolutely safe. If a woman starts hormone therapy later than that, that is when there could potentially be an increased risk of heart attack, stroke, and blood clots. Prior to the Women's Health Initiative, many women were on hormone replacement therapy and were receiving estrogen and progesterone from their gynecologist. Once this study hit the press, everybody was very afraid. Doctors stopped prescribing this medication. Patients were afraid to take it. They threw it down the toilet. And then there was a whole generation of women that really suffered because they were not able to reap the benefits of this medication because of the fears that came out of the Women's Health Initiative.